fatigue, increased blood pressure, decreased fluid intake. Or decreased fluid intake, I should say. Hot and cold compress. Hot is to dilate, open up. Cold is to constrict, close, prevent in spreading. To apply an ice pack, you always wrap it in a cloth, no skin on skin, or no ice on skin, I should say. Person on bed rest, you should do deep breathing exercise to prevent pneumonia. Now, emphysema. Lungs affect alveoli, tiny sacs in our lungs that allow oxygen and carbon monoxide to move between the lungs and bloodstream. Gradually damages the air sac in lungs, progressively become short of breath. Signs and symptoms, barrel chest, which is a large chest. Shortness of breath is number one. Smoker's cough, wheezing, decrease in sleep quality, depression, hypoxemia, which is a decreased oxygen level, and cyanosis, which is bluing of skin or bed nails, lips, stuff like that. The best position for them to be in is the orthopnic position, or orthopneic position is best. So to decrease the short of breath, you can get cool light clothes, moisture, encourage deep breathing, encourage fluids, give time to move. Condom catheter, have all your supplies ready. 2 condoms, urine bag, make sure you do pericare, explain what you're doing before, during, and after. Gloves, use alcohol swab, clean end of urine bag, open package, attach bag, apply condom directly onto the penis, apply tape, and tubing goes over the leg. Definitely make sure you bring your calculator as we're doing intake and output, and we're doing TPR charting. Make sure you're comfortable with temperature, pulse, respirations, and initials. Now, HIV/AIDS. HIV is human immunoid deficiency virus, and AIDS is acquired immunoid deficiency syndrome. HIV is the virus that causes AIDS. It attacks the immune system, preventing your system's ability to fight off infections. There's no cure, therefore death and dementia. There are stages of AIDS. Number 1 being Kaposi sarcoma, form of cancer, tumors, brown and blobby looking. Number 2 would be pseudo-pneumonia, which is chest breathing issues. All the signs and symptoms of a pneumonia. Basically, people would think they have pneumonia because they have all the symptoms, but it's not. And the third one being dementia. Signs and symptoms of AIDS is a decreased appetite, weight loss, 10 pounds without reason, skin rashes, swollen glands, dry cough, diarrhea, tired, fatigue, white spots in the mouth, cancer, bruising, and dementia. Care for them would be good mouth care, good hygiene care, observations, food, give them food they like, make sure they get rest. Safety is huge for them and us. No sharp objects and good lighting. Physical, emotional, and social needs need to be met. Just be there for them. Educate friends and family. Include them. The stigma is people think they are dirty. They think that they deserve it. A PSW can help by assisting with their ADLs, bathing for example, but allow them their privacy. Assist with their meals. They need to talk, so just shut up and listen. Ostomy, surgical opening through the abdomen to the bowel. It can be permanent or temporary. Causes of ostomy could be from disease or cancer, ruptured bowel, Crohn's disease, obstruction in the bowel, accident, injury, or damage. It looks like a rosebud, should be moist, skin should be intact, nerve endings should be cut. Use water only to clean sight. Around stoma you can use henna, removes gum, and protects the skin. Peri done 3 times a day. Their anus is surgically closed. Typically, it's a 12-hour operation. The ostomy flange usually lasts 3 to 5 days. Descending ostomy is the number 1 type of ostomy. Colostomy is the large bowel, colon. The ileostomy is the small intestine with the where the ileum is. The uterostomy is the bladder. So we will be doing charting, which is this chart.